I'm a fertility doctor, and here are some facts about IVF that I wish more people knew about. Dr. Sharon Moayeri, founder and owner of OC Fertility in Newport Beach. Fact 1, IVF is not the only option for everybody. When you see your fertility doctor, you'll have a bunch of testing done if you haven't already had it done. And sometimes you'll identify something that might need to be corrected, and that alone might lead to a pregnancy. So it's important to get testing because that might identify a factor that could lead to a pregnancy once it's corrected. In addition to that, sometimes less invasive treatment like intrauterine insemination or fertility-enhancing medications such as Clomid or letrozole might be beneficial, and all that's needed to increase your chances of getting pregnant. These are things you want to talk to your fertility doctor about before moving on to in vitro in some instances. It really depends on your situation. Number 2, IVF doesn't guarantee a pregnancy. A lot of people think that if they do IVF, they're going to get pregnant. So IVF success rates depend on many factors, including your age, the egg quality, and the number of eggs retrieved at a retrieval, not to mention the source of the sperm. Finally, the uterine cavity also helps determine whether you're going to be successful with IVF or not. And if you have any medical conditions, that can determine your success rates with IVF too. Number 3, egg quality and egg quantity retrieved at IVF also helps determine your success rates. The quality and quantity tend to go down with age, but there's certainly some patients who present at a young age with many eggs but poor quality eggs. And younger patients might have fewer eggs but better quality eggs. So some of this is hard to determine until you're evaluated. At the end of the day, it really just comes down to having a healthy embryo to transfer, and sometimes that can be identified pretty quickly with one cycle, and sometimes other people need multiple retrievals in order to find one. Sometimes finding a healthy embryo can be fairly easy for some patients depending on their age and the number of eggs that are retrieved. But again, if quality is really of a concern for some patients, it can take some time to find a healthy embryo. Again, the older you are, typically the poorer the quality of the embryos, but these factors are determined not only by the egg source, but also the sperm source and by a patient's history. IVF is both emotionally, physically draining. So make sure you have time for bed rest if you're doing your embryo transfer and your doctor recommends it, and that you have dedicated enough time for doctor's appointments, injection medications, and blood draws. Last but not least, IVF is not just for infertility. It's often used in other indications. It can be used for preserving your future fertility, either through egg freezing or embryo freezing. It can also be used for same-sex couples who want to do family expansion through either egg donor, sperm donor, or surrogacy. One of my favorite areas is for gene screening. If you know you have a specific disease in your family, you can screen embryos for that disease and identify that so that your child is not affected by that illness. So if you're thinking about in vitro fertilization, it can seem overwhelming, but here at OC Fertility, we want to guide you through the process step by step. Please reach out if you have any questions and want to get the process started.